Hey there! Today I'm talking about something that a lot of men are curious about, the side effects of Viagra, and more importantly, how to handle them. First off, most side effects from Viagra are pretty mild and can be managed easily. Let's start with flushing. If you're feeling hot and flushed, try opening a window, turning on a fan, or grabbing a cold drink. Lying down and resting can also help. Just a heads up, drinking alcohol can make flushing worse, so keep that in mind. Got indigestion? Taking Viagra with food might help, but remember, it could mean the drug takes a bit longer to work. Over-the-counter antacids can also be a lifesaver for your stomach. Check with your pharmacist for a recommendation. Feeling dizzy? Lie down and rest until the dizziness passes, then get up slowly. Staying hydrated can make a big difference. And, like with flushing, avoid alcohol and smoking because they can make dizziness worse. If you're dealing with back or muscle pain, try resting or a gentle massage. Over-the-counter pain relievers can help too. Again, ask your pharmacist which one's right for you. Now, if you experience any severe side effects, like chest pain, dizziness, or nausea during sex that doesn't go away when you stop and rest, a prolonged erection lasting more than 4 hours, or sudden changes in your vision or hearing, seek emergency medical attention right away. These are not things you should manage at home. A quick note. Viagra doesn't cause side effects in your partner unless they're taking the drug themselves. It doesn't pass into your semen in significant amounts, but if they're also taking Viagra, they might experience similar side effects. How does Cialis compare? Well, both drugs can cause similar serious side effects like prolonged erections and heart issues in people with heart disease. But there are some differences in the mild side effects. For instance, Viagra might affect your vision, while Cialis might lead to a cough or diarrhea. One key point, Cialis lasts longer than Viagra, so any side effects might stick around longer too. Lastly, if you're wondering whether a 100 mg dose of Viagra will cause more side effects than a 50 mg dose, the answer is, it might. Generally, higher doses can mean more side effects, but other factors like existing medical conditions or other medications you're taking can also play a role. In studies, some side effects like headache, indigestion, and vision changes were more common with the 100 mg dose, but many side effects occurred at similar rates regardless of the dose. If you're ever in doubt or concerned about side effects, definitely talk with your doctor. They can help you navigate the best course of action. Thanks for watching. Don't forget to like, subscribe, and hit the bell icon for more health tips. Stay healthy and take care.